Yesterday, Tina and I met with a cancer surgeon to go over the results of a scan, a CT scan that really focused on the artery behind the tumor in the back of my throat. This scan was important because it would determine whether surgery was even possible. If the tumor had grown too close or too big around the wall of the back of my throat, it would have been a more complicated surgery, or maybe surgery wouldn't be an option at all. Good news is the surgery is an option because there was enough space behind the wall of my back of my throat and my carotid artery. It's not a small surgery and it's not simple, but there is now a clear plan. The surgery walked us, the surgeon walked us through what he believes will give us the best possible outcome. I'll be put under, and the first step will be to remove a significant portion of the tumor that's about 1 to 2 centimeters, so it can be analyzed immediately while I'm still in surgery. And that will tell the team exactly what they're dealing with and whether this is actually cancer, which there hasn't yet been a complete diagnosis, um, definitive diagnosis. But the surgeon and all the team feels it's highly likely that this is cancer, but it might just be atypical cells that haven't quite fully crossed the line yet. But based on those results of the immediate biopsy while I'm under, the surgeon will then go back in and remove the entire tumor along with the additional surrounding tissues to make sure we get clean margins. Because of how much radiation my throat has been through in the past, the tissue back there doesn't stretch or heal the way normal tissue does. So during the same surgery, another specialist will be removing a small flap of tissue on my wrist area to be used to fill in the hole, basically, that it's going to be created by removing the tumor at the back of my throat. It's a long surgery, it's an all-day affair, and afterwards I'll spend several days in the ICU, followed by a few more days in the hospital. Altogether, I'm expected to spend about a week in the hospital and then another week staying nearby before we can drive the 3 hours back home. Because if there were any complications to arise, we wouldn't want to be so far away. So I want to be honest, there are definitely risks involved. Scar tissue adds to the complexity, and recovery won't be instant. Fortunately, though, I still have a voice when I wake up. But here's the part that matters most to me. Not having a plan was far more taxing on my nervous system than having this plan, which has risk involved. But even with the risk, there's relief in clarity, relief in knowing that the next what those next steps are, relief in being in the hands of a surgeon who specializes in cases like mine a lot. He's worked with this extensively with patients who have had heavy radiation before, similar to me. So last night, Tina and I slept a lot more soundly. Fell asleep early and slept relatively late, and so that tells me something important. Our body was telling us something important. The body knows when uncertainty starts to lift. Now, we're not pretending this isn't easy, and still has a lot of feelings involved, but we're not skipping ahead to the outcomes either. We're grounded, informed, and moving forward one step at a time. And for now, that's enough. All right, when I know more, I'll give you an update. Thanks for following.